I'm Candace, and you're watching Inside of New England's Therapeutic Talk. Today, I want to talk to you guys about why racism is a health crisis in this country. And this might be one of those difficult conversations, so it's just a heads up for everybody who's watching. It's a problem. It's actually been a problem for hundreds of years. Hundreds of years, if you can believe that. So, why is it that racism is a crisis in this country? And why, if it's been a crisis for hundreds of years, why is it that's just now people are just starting to talk about it? Well, here we go. I am just going to kind of tell you guys a few things that come to the top of my head and things that I've read about during this video. And I am going to give a quick little message to mental health providers at the end. I hope I'm saying all these things with the intent to help. I'm saying all these things in the intent for people to learn, to be able to start having conversations. I mean no harm or disrespect to anybody when I make certain statements, okay? So here we go. Why is racism a health crisis? Well, it is a health crisis because, to put it very simply, people are dying. People are dying every day. People have been dying for hundreds of years every day because of racism. So, why are they dying? Well, we all know from watching all of these videos over the past, people are being murdered, right? By police officers. They're being murdered by people for jogging down a road. They're being murdered. So I'm not even going to go into that, but we know that. So, but here's the thing. People are actually dying from racism because of medical problems and mental health disorders. And mental health disorders can lead to having medical problems. So, what are those problems and why? Well, we'll have trauma, right? Trauma from racism because every day your life is at risk, right? As a Black person in this country, your life is at risk. You don't know if you're going to be shot. You don't know if you're going to be murdered. You don't know if your kids are going to make it home. So these are stressors every day. So that's one thing. So that can be trauma, which could lead to PTSD, which could lead to depression, anxiety disorder, okay, and so on. Health problems such as diabetes, high blood pressure, heart conditions, which run rapid in the Black community. I mean, every single person in your family has these things. So why are we at risk so much? It could be foods that we eat sometimes, and I'm going to get into that as well. I honestly think, and from research that I've done on this, it is because of the stress that it is to be a Black person. So there's so much stress living your everyday existence that it's hard to take care of yourself. It's hard to be healthy. You are your immune system is not as high. And I'm going to show like a picture of a book at the end for you guys to look at because there's a lot of research on this guy did on monkeys, and it's really, really cool and interesting. So you should really check that book out. But it shows how if you're under stress every single day, right, that it can lead to having these health problems. So the stress can actually lead to having health problems. So that could be a reason why everybody in my family has these disorders. So when we look at food, right? Food and certain things like that. So if you, and when I was in grad school, I went around with one of my professors and we drove around and we counted how many liquor stores and package stores were in Hartford. And I'm just going to go with Hartford because that's what I know. There are so many package stores and places to buy cigarette ads and all of this stuff. But there are no Whole Foods, grocery stores. So if we, it doesn't take a brain surgeon, a doctor, it doesn't take somebody too brilliant to figure this out, right? If the neighborhood that you're living in only has those things, you're more likely going to be doing those things. There's going to be more crime. There's going to be less healthy eating going on. So that's very, it's just common sense. And the research that that doctor was doing was on health disparities, ironically. And, trying to figure all of this out and trying to prove that that is what's happening here. So, knowing that, if you guys look back at the video that I did on Tiana Layboy, she had to give birth in a prison, right? A gentleman at that thing that I was at for her gave a beautiful speech and mentioned how health care in this country, especially for Black women, is so unequal. Like, we have no idea if we're actually going to be treated the same way when we go to the doctor's office. We don't have the same access to having health care anyway. And if we look at employment, and well, let me take a step back. If we look at the rates of child mortality, right, with Black women, that just shows us right there the disparities, the amount of women who are dying, children that are dying. Just look at the numbers. If we look at employment and we take a look back at the video that I just posted on names and stereotypes, which I will put all these on the description of this video, so you can take a look at them if you haven't. If we look at that and we see how there's not equal access to employment, even just on a person's name. So if you don't have the right financial situation, which systemic racism feeds off of that, okay? Because the way that this country is set up with systemic racism and not being able to have access to healthcare, not being able to have access to employment, not being able to have access to education, the likelihood of you being able to go shop at a Whole Foods or not live in Hartford are going to be kind of slim, right? So what are the likelihoods of you surviving? Just something to think about. And not being under stress every day of being killed and murdered, or your children being murdered, and so on. So, just things to think about, right? So my message to mental health providers, knowing this, or if you've listened to what I said, or if you're just learning this, that's okay. If you already know about this, if you're a Black provider or a white provider, I don't care, Asian provider, I don't care who you are, right? This is a crisis. This is a crisis here in this country, right? We are seeing clients who are in this crisis, who are dying, who are under stressors every single day here. So we need to make sure that we're educated about what's going on here. What things are happening right now to try to help, because we're healers. We're here to help. And I think it's important for us, as being the healers, that we help, and we know about these things and educate ourselves. And I think it's really important. I was just told the other day by this lady that I am a unicorn. And that's such a beautiful thing to be called. Oh, I'm a unicorn. Because there aren't a lot of Black providers in this country. So, with that being said, if you are a white provider or a different nationality, whatever, and you're working with Black people right now, I think it's important, and the only reason why I'm saying this is because I know from experience that there have been providers that I have come into encounter with who have not understood this. And I have tried to explain, and I know it's not really taught in counseling school because I went through counseling school. So I don't know if it's really the topic of the conversation, even in the multicultural classes. Unless you had me in your class and I brought it up probably every time I gave a presentation. You're so lucky. Sorry, I have to put some humor into this. That it's gonna be really important for you to gain some knowledge, to get involved, to find out what's going on and what you can do to help, and really understand the trauma, right, that people are experiencing on a daily basis. And the systemic racism is real, and this really is killing people. So I think really acknowledging that is so important. And I hope that people don't take this the wrong way. But if you're not willing or not able to get in touch with that and understand how that's a crisis, how this is a crisis and it's killing people, or wanting to be involved or wanting to understand the things that are happening, the movements that people are taking to be acknowledged as human beings. Because I'm not sure, I think I said this in the beginning, but the reason why this has been going on for hundreds of years and nobody's actually paid attention to it is because, and I'm going to put it really simply, Black lives just don't matter. So if that's something that you as a therapist or health provider or even a medical provider, because people need the care that they need and the help they need. If you are a provider, we know we're not supposed to do harm. Do no harm. So if you know that you're a person who's just not going to be able to get in touch with that or be able to help with that, then make that referral to a provider who can. I am begging you to. And I think being honest with yourself and knowing, because we all know, I know that I learned this in school, that we're supposed to know what our biases are and know what groups we can and cannot work with. And I don't think there's anything wrong with making a referral to somebody who can work with that individual or that family. Because if you're not going to be able to do it and do it right and not do harm, then I would suggest making a referral so somebody can do that person the justice that they need and help them to overcome whatever struggle they're having in that moment. and being able to meet them and care for them the way that they need, because people are dying because they're not getting what they need. And we need to really understand that. So, and acknowledge that that's what's happening. So, that is my little rant on not prepared at all. I just got up here with this little tripod and wanted to give this message. So, I hope that I didn't offend anybody. I hope that people will just take this, listen to it, say, hey, that's that girl's opinion. And, hopefully learn something. Hopefully, if you're a provider, you're thinking about this right now, because I really think that it's so important, like, especially providers right now, because, and knowing that people have died because they haven't gotten the care that they were supposed to get. I mean, it could have something to do with us as providers, right? So, I mean, I would do the same thing. If there's somebody who I know needs a higher level of care or needs a different type of provider, I'm going to make that referral. So this is no different from that. So I hope that everybody stays safe, stay well, stay safe, stay well. And may peace and love always be upon you, everybody. Black, yellow, white, brown, purple, alien, whoever, whatever you are. Female, not female, male, I don't care. You are a human being and you deserve to be loved. And I want peace and love to be upon you at all times. And I mean that from the bottom of my heart. And I hope that you guys are safe. Please stay safe. And I will talk to you again soon. Thank you. Bye. This is the book that I was talking about. It's research that was done. It's called Why Zebras Don't Get Ulcers by Robert Sobalski. I just want to give a shout out to all of my doctors who have helped me.